Welcome to How to Stay Sane with Karen Jordan. We're joined today by Dr. Ari Steinberg. She is a clinical program manager with the Webb Schools at the Institute of Living in Hartford, Connecticut. She has a bachelor's degree from Wellesley College and a PhD in clinical psychology from the University of South Florida. Thank you for joining us today, Dr. Steinberg.
Thank you so much for having me. I'm really excited to speak on this topic with you.
Thank you. We're excited to have you. So, first of all, everybody is familiar with working out and how important it is to get exercise. I think our doctors drilled that into us. But what impact does working out have on mental health in particular?
Well, I'm glad you asked that. As you said, I think most people understand the physical benefits of exercise, helping with preventing chronic disease and raising our metabolism, increasing bone density, all of those kind of physical positive impacts. But I do think people are not aware of what physical exercise or activity can do to help improve mental health. There really is a connection, a positive impact on a multitude of mental health issues with regard to the connection between physical exercise and mental health. Some of the areas that have been researched most frequently, depression and anxiety. Obviously, there's connection, has a positive impact on reducing depression, alleviating anxiety. It also has connections with substance use disorders in terms of reducing urges and helping, with cravings, PTSD. There's been a line of research that suggests that just getting up and moving helps people reduce PTSD symptoms in populations. I think, the other piece to this, those are kind of mood disorder related issues, but the relationship between the brain, the impact on the brain and the brain chemistry with exercise also affects disorders such as psychosis, attention deficit disorder, and even autism spectrum disorder.
Interesting. And you mentioned anxiety. Are there particular exercises that can help with anxiety, or how can exercise help reduce stress even? So some of the, kind of the positive effects of exercise on anxiety disorders, there's a lot of different avenues by which that, exercise affects it. First and foremost, it has been shown that physical activity can decrease the intensity and frequency of anxious thoughts and feelings, especially in the area of generalized anxiety, panic disorder, and related, if we say that stress is, kind of a form of anxiety, it, alleviates stress. Part of that is that exercise and moving your body in general really helps to reduce muscle tension and the physiological arousal that often comes with anxiety disorders. So just by getting up and moving, you're kind of putting your body in more of a relaxed state, which is contradictory to someone who's experiencing anxious thoughts and feelings. The other thing that I think is really cool, and there's a line of research that is actually using exercise as a form of treatment for panic disorder. And the rationale behind it is, if you think about a panic attack and the symptoms that people experience during a panic attack, such as increased heart rate, sweating, heavy breathing, maybe feeling dizzy, a little nauseous. If you think about somebody who would be exercising to, at a higher intensity, those are very similar symptoms that you might experience just through exercise. Yes.
So what they're doing in terms of treatment is as simple as bringing someone into a room
putting them on a treadmill, getting them to start running, get their heart rate up, have them experience all of those similar symptoms in a safe environment, and actually help them to find ways to bring down their heart rate, decrease their breathing. And then ultimately the goal is, if they start to experience those symptoms during a panic attack, A, they can recognize that they are just physical symptoms that they have control over, and they have been provided the strategies needed to be able to kind of help manage and cope with the anxiety. So I think that's a really neat kind of, not just the relationship, but actually utilizing exercise to treat anxiety, which I think is kind of cool.
That is excellent.
The other piece, and this is for, I would say, the biggest contributing factor in terms of the positive impact of exercise on any of the mental health disorders or issues, is that physical activity has been shown to actually influence a lot of the same neurotransmitter symptoms that are targeted by, right now we're talking about anxiety. So it affects the serotonin levels in your brain, the dopamine levels, norepinephrine, and all of those neurotransmitters are actually what, like, anti-anxiety medications are created to affect within the brain chemistry.
Interesting.
So it's really, I think it's groundbreaking that, maybe someone who's not really interested in medication or that doesn't have the means or the interest, simply by exercising, they are getting the same effects that they would if they were on some sort of medication regime.
That is fascinating and so good to know.
Yeah, and I think that's something that a lot of people don't understand. I think people, we all know about endorphins and the runner's high and all of that, but it goes above and beyond that. I mean, exercise can really alter your brain chemistry. It can actually alter your brain development. There is it's called, I don't want to get too clinical, but it's called BDNF. It's brain-derived neurotropic factor, and it is in the brain. And really the role that it plays is it plays a role in differentiation, extension, growth, and maintenance of neurons in the brain. It actually creates, what we call cognitive plasticity, and can create new connections in the brain. And exercise actually has a direct effect on your BDNF levels in your brain as well. And it's also been shown to increase brain volume, just exercise, especially in the areas of like the hippocampus and basal ganglia, which are all, connected to concentration, focus, executive functioning. So, while we think we're doing good for our body when we exercise in terms of our heart and cardiovascular fitness and all of that, we're actually really improving our brain functioning and brain chemistry.
That's excellent. So is there like an optimal amount of exercise that people should aim for on a daily basis? I know for the physical benefits, that there are standards and how many days a week. From my vantage point, I really kind of follow a simple rule for people when I'm kind of working with children and adolescents or clients with regard to kind of how do we incorporate exercise as part of our therapeutic interventions. And really, it's about moving your body in a way that's going to raise your heart rate, because that's important, is enjoyable enough that it creates some sort of consistency, so that you're doing it on a consistent basis. I would, if I had to, if I was pinned down, I would say you really want to have at least 10 to 20 minutes of some sort of physical activity. The other thing to remember is, I think people, when they hear the word exercise, there's sometimes a negative connotation, or like, oh, I'm not fit. That's good. That's too hard. That's too much work.
they think of exercise as punishment almost. And I think really the message is that it doesn't have to feel like exercise. Like, you could go out for a walk or you could go for a hike, any kind of physical movement, just getting up and moving your body. Because I just think sometimes when we attach the word exercise to it, it automatically creates a deterrent for a lot of people.
Yes, I agree totally, because people see it as a chore, like you said.
Yes, yep, exactly.
And so that's great to aim for that on a daily basis. Are there, as far as though, how many times a week should people keep in mind? Is this something that needs to be done 3 to 5 times a week, or?
Well, I think the truth is that the impact that an individual is going to feel from getting up and moving their body or doing some sort of physical activity is pretty immediate. So, my thought is, again, like, listen to your body. If you're doing some sort of physical activity twice a week, but you're not really feeling those results, let's increase it by a day. But the nice thing is that I think once people start to feel the positive impact, that will naturally motivate them to kind of increase the frequency of the exercise throughout the week.
Well, that makes sense. Are there some physical activities that are better than others? For example, I was reading that there's been a study that, lifting weights or resistance training can help reduce anxiety. What do you think of those particular physical activities?
So the good news is, I think, because, again, if I were to come and tell you, like, the only thing that's going to have a positive effect on your mental health is getting out and running a 5K, like, how many people are going to say, oh, yeah, sign me up?
Right.
So the nice thing is, the good news is that pretty much any kind of exercise is going, the research has shown there's a similar effect. So whether it's aerobic, like, doing some sort of cardio running, kickboxing, if that's something you enjoy, versus someone who might want to do strength training, like you mentioned, like, those types of activities will actually provide a similar effect. So you don't have to, hopefully you'll choose something that is enjoyable. The other area is kind of the, mind-body exercise, yoga, meditation. Those really are the best, I would think, for calming your nervous system and reducing anxiety, because so many of the therapeutic interventions we do, in an office setting is mindfulness, grounding, all of the things that, are essential to a lot of yoga and mindfulness physical activities. There is some research that does suggest, in terms of whatever activity you choose, that higher intensity, working at a higher intensity, and I think it's probably tied to heart rate, getting your heart rate up higher, which then, is going to impact blood flow and all of those things, which again contributes to cognitive functioning. That higher intensity activities tend to produce superior results to lower intensity. But the truth is, if you're someone who doesn't exercise at all and you start at a lower intensity, that's still going to have a positive impact, and then it allows you the ability to maybe over time increase the level of intensity that you're exercising at. The other area, which doesn't really have much to do with, it's more of a psychological kind of positive result of exercise, is if I think about team sports or group activities, group-based activities. It really helps, for a lot of people who are suffering from a mental health issue, whether it be depression or anxiety, a lot of people feel alone and they feel isolated. And getting involved in a gym or joining some sort of team sport really creates that automatic connection and support. And the other piece that I like about it is it provides that accountability factor.
Yes.
So, I always, if you join a gym and you start going to the Wednesday night, Zumba class,
and then you all of a sudden don't show up, people are going to ask, like, where were you? Why weren't you there?
Yes, that's true.
So, I think in terms of what types of activities, and that's kind of, I think the good news is all activity is better than no activity, and it gives people the ability to choose something that they actually enjoy. And again, I think the most important thing is finding something that you enjoy enough to promote some sort of consistent physical activity.
Those are excellent points. Yes, definitely. Now, what is something that you would say a lot of people don't know about exercise or misunderstand that you think people should have a knowledge of?
Well, I think we discussed this a little bit before, but I think that if people could change their perspective or shift the focus of thinking of exercise, again, like we talked about, as a chore or something that they have to do, I think, it shouldn't be something that you dread. And that exercise doesn't have to mean, I just think people think exercise and they think, running or, something really intense. And it really can be any kind of physical movement or activity that you enjoy, so that you're changing the focus from exercise to just moving your body. And then, as I've shared, I think a lot of people don't understand the relationship between physical exercise and the impact that it has on kind of, the mental health piece, but also like your brain chemistry and functioning. I think as we age, I think there's a lot of research that suggests that physical exercise really helps with concentration, focus, memory, all of those brain functions that can potentially deteriorate as we age. And a way to counter that is just getting up and moving our body.
Yes, that's very important. That's key. I think you've given us some great nuggets to just really chew on and also hopefully inspire us to work out this week.
Well, thank you. Yes, I hope so. And I will say, just to share a little bit of a personal kind of where my interest came from in terms of physical exercise and mental health. As you had mentioned, I did my undergraduate work at Wellesley, and then, I went and got a PhD in clinical psychology. I actually took a break from the field for a little while when my children were young, and I actually worked as a personal trainer, and I got involved in the world of fitness. It had always kind of been a part of my life, but when I went to psychology and went for my postdoctoral training, it really, the connection between mental health and exercise from both, my book learning, but then also working as a personal trainer, and oftentimes feeling like I was a personal trainer / therapist, it really piqued my interest. And when I came on board at Grace Webb and saw the level of kind of inactivity that a lot of our students are very, unhealthy, not fit, very lethargic, play a lot of video games. It really motivated me to kind of, I actually created, it's called Webb in Motion, and every morning, K through 12, we spend 10 to 20 minutes doing some sort of physical activity.
That's great.
As a group across the different schools. In the first year that we implemented this program, believe it or not, we had almost a 70% decline in our behavioral incidents, restraints and seclusions, work completion. Like it had a huge impact on our community, and
That's
to this
excellent.
day we still engage in Webb in Motion every single morning.
I really enjoyed having Dr. Ari Steinberg on today's show. I think I may need to add weightlifting back into my Pilates and power walking routine. Join me next time on How to Stay Sane with Karen Jordan.